All right. Well, welcome everybody to this second presentation of the study that has been completed over the past year by the Child Care Issue Group. For those that haven't met me before, I'm Maria Puzzi and I chair the group. I'm also joined by Beth Carriel, who is one of our most passionate members and biggest child advocates out there. So grateful for her partnership throughout this entire process. In this session to this evening, I'm going to be walking through the story of this study, why we did it, how we went about it, and what we found. And then previewing the questions that we will be sharing with all of the local leagues. And in fact, they should have already gone out to all of you to sort of start the consideration process that will be happening over the next couple of months. So without further ado, I'm going to jump into it. We started this study or proposed to complete the study because we recognized that the current position for childcare in Virginia was not matching the moment as fully as we thought it should. The last complete study happened in 1985 to 87, and it focused primarily on the biggest topic at the time, which was the health and safety of children in organized care, and goes into depth about specific safety recommendations that at the time, it was very important for the league to engage in. Now, child care has come a long way since then. There's been a lot of research and a lot of evidence generated around the importance of early learning and childhood early development. And so wanting daycare to be more than just a safe place for children to go while their parents pursue paid work outside of the home. And in addition, there are financial considerations, equity considerations, not just for early learning of children 0 to 5, but also for after school and out of school time, knowing that not many parents, including myself, would allow my first grader to spend extended periods of time on their own and therefore need some form of not just safe care, but also opportunities for enrichment and learning outside of school time. So for all of those reasons, we undertook this study. We recognized the power of the league to really be an advocate in these spaces. And imploring us all to really lean into these conversations and leverage the platforms that we have, especially in this moment coming out of COVID. We've all seen the headlines on learning loss. We've all seen the crises of women, especially not being able to return to work or just not being able to make the economics work, given what we'll be showing you all in terms of the business around childcare. And so because we wanted this updated study to be comprehensive and to really look at all these different aspects, we organized it around stakeholders. So we want every parent, especially Black and minority parents, to be able to lean in to work if they so choose. And I'm actually, Caroline, can you pause the recording for 1 second while I switch out the presentations? I'm noticing that. So resuming with the right presentation, we want every child care provider to have the ability to deliver quality care and to remain operational and not have to choose between the two. We want every young child to be healthy and safe in their setting, but also to learn the requisite skill to be ready for kindergarten. And then we want school-age children to have a safe, nurturing place to go after school. So this was the North Star that we set out as the vision for ourselves in the study. And then we asked ourselves, well, what will it take to get to this North Star, and that was the research that we conducted. And the way that we went about this study was in part through source documents. We looked at rigorous evaluations, we looked at documentaries, we attended webinars, we consulted some administrators and managers of childcare programs. We also spoke to 2 Virginian families and childcare providers in Virginia, overall consulting about 50 different stakeholders from across the state, really trying to capture rural, urban, suburban representations. We analyzed cost data, national census data, and then we looked at what other states are doing in terms of solutions, as well as what other League of Women Voters positions offer up in terms of how they have organized. And once we'd completed all of that research, we really dug into, well, what makes sense for us, and especially based on what is already happening in Virginia, because we wanted to really reflect the unique context that is our Commonwealth, and how the Virginia Department of Education and the Virginia Department of Social Services collectively have organized the legislative, administrative, regulatory framework of childcare, and then diffuse the administration of that down to the localities. So we wanted to build our proposed recommended solutions within that sort of reality of how that's organized in our state. And then we, as an issue group, have taken all of that information. We're presenting some very clear recommendations on what we think our updated study should be, and asking you all to, read the same information that we've found and see if that's something that you all agree with, or if there are other considerations. I will say that it's very important that at this study and position forming stage, we are really focusing in on what we want the position to be, not what we want the advocacy to be. And what does that mean? That means that we are setting for ourselves as a league the vision for the child care of the future that may not be revisited for another 30 years, right? If position studies happen every 20 to 30 years, we want whatever our updated position to be to stand the test of time, irrespective of legislative fluctuations, budgetary fluctuations, whoever holds the governorship, whatever funding priorities may need to be set along the way, right? So that's you'll notice as we dig in to each of these elements that's really what we're focusing on at the moment. And then in the hopes that we do get to a more updated comprehensive position, we would be working as an issue group with the board and with you all to define what our legislative priorities are year over year while working towards that North Star. So just kind of keeping in mind is like right now we're thinking position, and then into the future we'll think advocacy. All right, so let's look at a little bit of history for childcare. For those of you that may not have ever had to deal with childcare, or it may have been a while since you had to deal with childcare, just want to provide this little timeline, or actually it's a long timeline. It's been thought about in the US for quite some time, but given this long time, some progress has been made, but not nearly sufficient, especially in comparison to what some other countries have done in this time frame. But all of sort of industrialized first world, Western world started thinking about the need for support to particularly mothers around the turn of the century with industrialization. And in the US, we had something called the mother's pension, which meant primarily to widows when husbands were no longer around to support. We started having day schools, day nurseries in the early 20s, sort of in pilot form. What would it be to actually structure learning? for young children. And then in World War II, really leaned into a need caused by women being called into the workforce to have some sort of more organized care. And that was similar in a lot of countries, and could have led to sort of a formalization and an expansion of organized care settings, especially with the war on poverty coming out of World War II. The federal government created what is the Child Care Development Block Grant, the beginning of child tax credits and the Head Start program, all as recognitions that when women work, there needs to be some, when both parents work in a household, there needs to be some support for childcare. And that actually led to a pretty incredible bipartisan bill in 1971 that would have universalized preschool and childcare, similar to what other industrial countries were doing at the time. Nixon, for very clear reason, very clearly stated, I do not want this because it will challenge the core family values and the core family structures. So basically, a woman's place is in the home. And he vetoed the bill. And that was the last time childcare was really thought of as a universally accessible initiative. For the next 40 years, the focus was more on improving the care that did exist, mostly on the private market at that point. So making it more, safe. This is where our previous position came in, ensuring that there was increasing attention to quality, and early child brain science started to influence the need for curriculum and the need for certification among teachers, and not everybody should be, licensed to look after children in sort of a learning mindset. Ratios, were added, those kinds of things. And all of those increased the costs to providers of delivering this care without having matching support for those rising costs. So for several decades now, it's been costing more to deliver the care without families being able to cover those corresponding fees. And so that's kind of led us to the crisis that existed even before the pandemic, but really was exacerbated with the pandemic. It just all came to its head. And finally, the federal government was ready in some ways to kind of acknowledge that need. We saw some great movement last year, on proposals within the Build Back Better Act, especially to reinvest in childcare. There was some incredible emergency funding appropriated and allocated through the COVID Rescue Acts. And yet in the end, those initiatives now seem to have, at least for now, gone away as the refocused Inflation Reduction Act focused on healthcare and climate change, all of the family programs that we at least were hoping for in terms of childcare, parental leave were taken out, and the stabilization funding that has essentially propped up the entire childcare industry for the past couple of years is set to expire in 2023, early 2024. So we have a new crisis brewing here. Once those funds go away, we're going to see some renewed headlines of centers really struggling all over again. So that's just the sort of historic context of where we were and how we got to where we are today. I mentioned that we wanted to look at this from several different perspectives, and these are the perspectives. So there's a cost affordability element, there's an accessibility element, thinking especially geographically. If you have seen one of the education equity presentations or looked at their study report, they really dig into that aspect of equity by geography, which plays into early care and school care as well. Then, of course, the elements of quality and health and safety still remain. And what we also really wanted to do was understand equity as it intersects with these various different pieces, because when you dig into the data and really look at affordability, for example, you understand that varies greatly by income, by location, by demographics, such as children and families who speak English as a second language, who have special needs or are disabled. There are also some racial aspects that intersect across the board. So just capturing all of these various different pieces, and let's take a deep breath. We're going to dig into each of these so that we truly understand this issue from all these different puzzle pieces. We're going to start with accessibility. And this is grounded in the Virginia Code, because the Virginia Code currently states that the State Board of Education should establish a unified public-private system for early childhood care and provide families with coordinated access to referrals, and then have a data system to manage this. The programs that they mention in terms of the public's contribution to these are only a handful. Like, there are only a few programs that actually are publicly funded for early care and education, and they cover only a fraction of needs. So what the code really states is that it's up to the private market to deliver this, and that it's not a guarantee that every child has access to it. All they say is we're going to provide a system. It doesn't say every child has a right. And because of that, the private system is not incentivized to reach children where it doesn't make economic sense to go. It's a classic market dynamic. You go where the demand is and where people are able to pay. And if people aren't able to pay, then there's no providers. And we'll see that on some of these maps that we're going to be looking at. Administratively, and this is a good development, the management of early childhood care and education shifted from Department of Social Services to the Department of Education in 2021. That was Pamela Northam really led on that initiative. And that has at least put the concepts of quality and health and safety and affordability into a single entity, because it used to be separated and thought of as differently. And it used to be, is this a public benefit, or is it like an education right? And having it with the Department of Education really allows us to think of it as an education, the same way that we think about K through 12 education, is that this is just an extension of early learning and after school learning. So what is the demand for accessible childcare? Well, it turns out it's really big and it's really not met. So for children, there are about 900,000 children ages 0 to 12 in Virginia with working parents that would likely require care. I mean, this was an estimate. There are also some number of children who don't have working parents because the parents can't afford childcare, therefore they're not working. So, there's a fluctuation in the demand, but assuming around 900,000 children overall, we can break that down by age group. So for children 0 to 6, research and surveys out there have estimated that there has been a year-over-year increase since 2014. Not a huge one, but somewhat of an increase, but a pretty significant decrease in demand, even before, or in available slots, even before COVID. And so even before, the crisis that brought on COVID, and then, families pulling their children out, centers closing, the economics were just not making sense for providers. They simply could not pay their staff enough, cover their costs to remain operational. And so the slots were decreasing, and about now we're meeting only about 57% of demand. The story is even worse for after school care. And I keep mentioning after school or out of school care because it does not receive nearly enough the same amount of attention, even though the need is there. I know many women with mothers with school-aged children who would like to pursue paid work, but who don't, not because they have young children, but because they don't have anybody to meet their children after school. And so, or cover summertime, and so it equally impacts the broader economy. It also can have huge impacts on equitable learning for children who have access to enrichment activities and after school support, summer camps, that kind of thing, versus the children that don't. And here we meet even less of the demand. A recent survey completed by a group called the After School Alliance found in Virginia a demand of about 700,000 for this group, with only about 160 slots available. So meeting only about 21% of demand. Here's the map, and while it looks like there are lots of dots, there's still lots of gaps. And the legend for what these various different dots are is included in the study report. They essentially are different kinds of care. So, just preschool programs, after school programs, Head Start programs that participate in something called the Virginia Preschool Initiative. So just lots of different dots, but really important to note that in several counties, especially in the more suburban and rural areas, there is some vast empty spaces, which means families living in those areas have access to no private or public care that is licensed. And licensed means that, it's registered, it's regulated, it is, legal. And so what's happening instead is, children are going to, family members, and there isn't necessarily anything wrong with that, or they're going to unlicensed care facilities, which there is a heightened risk of health and safety violations. There's less opportunity for, having an organized curricula and benefiting from that. And just puts a whole lot more pressure on families and communities when those options aren't even on the table. So showing in various different numbers and visuals just what all of that accessibility looks like. All right, shifting gears to affordability. So again, I mentioned that by and large, most early childhood care and education across the board is delivered through private providers in Virginia today. And the average annual cost for this private access to care is about $14,000 for an infant. So that's like 0 to 1, 0 to 2. And then for older children, 0 to kindergarten, it's $10,000. So this means that a median income family in Virginia with 2 young children could spend upwards of 30% of their income on childcare. Way more than it costs to live, eat, insure your car, pretty much any other expense in your household. You could be spending up to 30% of your income. So it doesn't take economists to understand that those economics just simply don't work. To be affordable, the federal government deems that childcare should only cost about 7% of your income. That is sort of the the nationally understood benchmark of affordability. And only about 11% of Virginia families actually make enough to cover that on their own. Everybody else would need some sort of support to, either as a subsidy to cover the cost, or just access to a publicly run and funded program. And so that just kind of shows you that, again, the magnitude of the problem with the cost of care in Virginia. So even though it costs so much to families, that doesn't mean that child care providers are flush with cash. I mentioned that, even though they're receiving these funds from families, their cost of operations are so that it doesn't make economic sense for many of them to remain operational either. And because they can't really affect the rules and regulations that govern their ratios, so they can't just, take on more children, they have very little control over their operating expenses, overhead, insurances, supplies, those kinds of things. The one variable that they can affect is their staff salaries. And so even though, preschool educators require a bachelor's degree, they make only about $16 an hour. If you are caring for a younger child that only requires, an associate's degree or a certification, the average pay is about $11 an hour. And I don't know how many providers in our interviews said, we can't compete with Target. We can't compete with Kentucky Fried Chicken or Chick-fil-A, because, for people that don't have education, they're choosing those careers and professions over, early childhood. And for people with bachelor's degrees, they're choosing K-12 education rather than going into preschool classrooms. So huge staffing shortages. About 70% of providers that recently responded to a Department of Education survey said that they are facing staffing shortages and are unable to fill those positions. So what is the government doing about this funding conundrum? Well, the two main tools that they have at their disposal is to offer subsidies to parents to help cover the cost of private care, essentially. And there have been some reforms to the subsidies in recent years, especially a pretty awesome initiative to realign the maximum reimbursement rates of subsidies to the true cost of care. And this is excellent because for years, providers simply weren't accepting the subsidies because, it was like a Medicaid thing, like they would be forced to accept lower rates for the children and the families who were bringing subsidies. And so hopefully with the increase in subsidies, that will be a reason for more centers to participate in the program. But there are a couple of issues even with this, and this is what we're hoping to, still keep advocating for into the future. The first issue is a provider never knows how many of their families are going to actually be bringing in subsidies. So even if those subsidies are helpful in covering the true cost of care, it's only for those children. And so if I'm a provider needing to make decisions about what to pay my staff, I can't know for sure how many of those children are going to, be having subsidies versus how many private families. So it's going to be still hard for me to make decisions about what to pay my staff based on the subsidy being higher. The other thing is there are still going to be thousands and thousands of families in Virginia who are not going to who don't qualify for the subsidy. The cutoff for receiving a subsidy right now is 85% of the state median income, which you can see there is about 89,000 for a family of 4. So if you're making 90,000 as a family, as a household family of 4, you don't get the subsidy. And again, you're having to pay 30% of your income then for private care. So, you know, while the increase in subsidy is good, it still leaves some pretty glaring realities for many families in Virginia. The other thing they do is they directly offer slots. So the government and the state government can leverage some federal funding, as well as having set up this preschool initiative called, you know, the Virginia Preschool Initiative that literally pays for the slot to families who qualify. So, you know, families with special needs, very low income, like very low income, way below 85% of SMI. So there are some families who don't even have to apply for the subsidy. You know, they get access to some of these programs. Head Start is federally directly funded from the federal government. So there are some options like that, but it covers a fraction of the actual need. You know, we're talking less than 50,000 when the real need is like several 100,000. And they are not evenly distributed in terms of access throughout the state. So, you know, you might have a county where 50% of people are below the poverty line, and you have one child care provider offering one program for those families. So good, but insufficient. All right, moving on to quality. So take a breath. I recognize I'm moving quite quickly through these, covering a lot of ground, but you can see how thoroughly we dove into all of this and all the different angles that we considered. And so with respect to quality, this is how well these programs are actually working. So, you know, pretending that even if you can make them fully accessible, fully affordable, are they any good? And we want them to be good, right? We want children who attend these programs not just to be, you know, in a location, but we want them to give enrichment, learning, social, emotional, academic, because then they really can help address some of those equity pieces and ensure that all of our children are able to gain the skills they need to go on and live fruitful, you know, productive lives. So in quality consideration, there's a need to measure and define, like, what do we even mean by quality? And this is where the Department of Education really has done some incredible work. They have created or updated a measurement system that's called Virginia Quality Birth to 5, VQB5. And they will be requiring next year, they've been piloting it now for a couple of years, and they're going to be requiring all programs who receive any sort of public funding, so whether that's the subsidy or whether that's offering, you know, a slot in the Virginia Preschool Initiative, they're going to be requiring all groups to participate, and with the idea also that anybody who is licensed needs to participate. And they are offering support for making that transition. By 2024, they also hope to publish rankings and scores. So that gets to the second point, which is around accountability. If we're going to have this measurement standard, if we're going to, you know, require everybody to participate, we're also going to hold groups accountable for it. And it seems to be a good measure, you know, unlike, I think, the previous quality standards, which dug more into like every teacher needing to have a bachelor's degree, you know, like that's a proxy just for having the qualifications to be able to effectively engage students. And the new measure is looking at more holistically, what are the teacher-child interactions like, using a measurement system for that. So that's just assuming that somebody having a bachelor's degree is automatically going to make them an effective teacher, kind of thing. So we're really excited about those. We applaud those. Our big question around quality is ensuring that everybody does participate. So that gets to some of the other pieces around, well, there are still a number of providers that are exempt from licensing, that, you know, are exempt from participating if you don't take subsidies. And so because we believe in this system, you know, we want everybody to be participating in it. So that's kind of what we focused on a little bit, with a specific focus on after school, because there are very few after school programs that are like licensed. It's one of the biggest exemption categories. And so what does it mean to have quality standards for after care programs that are meaningful? There's a group called Virginia Partnership for Out of School Time, VPOST, which have offered up some standards and quality measures on a voluntary basis. But they also recognize more exploration and more consideration is needed to see what makes sense from a voluntary point of view into sort of a required point of view. So those are some of the outstanding questions that we would want to tackle in the years to come. Finally, looking at health and safety. So this is ensuring that those who provide care take the necessary measures, follow the rules, and a very big standards book for 0 to 6-year-old care on essentially to mitigate the risk of harm and injury. And again, in our study group, believe in these standards, you know, a lot of effort. The Charlottesville League, especially, you know, did its independent study, digging into some of the health and safety measures that may still need to be there. And from our state's position, the biggest thing that we are advocating for is that these standards, or that we would propose, is that these standards be continuously revised to reflect the federal updates that are being made by the U.S. Department of Health and Human Services, Administration of Children and Families. So they recently, for example, updated their standards, and our recommendation is that, you know, Virginia does the same on an ongoing basis. We also, around licensing, believe that is the sure way to ensure that these standards are reflected. And right now, you know, Virginia, when they created the whole licensing program, offered exemptions for religious institutions in particularly, and day home providers who were caring for a fewer number of children. And while in some respects those exemptions do make sense, the process of becoming licensed, you know, does take a bit of work, and it does require then adherence to these health and safety standards. But that's what it requires, health and safety standards. It doesn't, you know, what the religious institutions are super nervous about, which is infringe on their ability to run a curriculum. You know, that's a separate thing. That's a quality thing. And the religious institutions are very free to, you know, adopt the curricula that they know work. That shouldn't impede them from then also adhering to health and safety standards. So it's our position that we should reduce the amount of exemptions to licensing, and really do, require, but also support, especially smaller day home providers. We want to make it possible for them to participate as a licensed providers and not make it so cumbersome or burdensome that it's not feasible. All right, so then finally, we just want to reflect on this equity perspective, which is with respect, which intersects with the other pieces. So with respect to access, most providers exist in urban settings, and that's where families have the most choice. In suburban and rural settings, if there are providers at all, there is not choice. And as a parent of almost 3 children, I really do appreciate the ability to choose whether I'm sending my 4-year-old to a preschool or an in-home provider. And I think, and our hope is that that choice can be extended to as many families as possible. There are also some families that require specialized or different types of care simply because of where they work, the hours they work. There's a cultural element where they need information in different languages, for example, in order to even understand the choices that are available to them. And so wanting to ensure that when we talk about accessibility, we're not just talking about increasing access in certain places or, with 9 to 5 care, that in all English speaking settings when that's not the families in that particular community. And so by layering that equity lens, we are able to dig a little bit deeper into what does it truly need to be accessible. Similarly, on the affordability front, wanting to ensure that we're not just saying, well, if we increase subsidy, that's going to make things more affordable, and that's going to mean that families have more access to funding if the providers in their area are not accepting those subsidies. Or if what they really need, is a slot and that's not available. Or if they need care, that isn't provided with, or if they need the kind of care that subsidy doesn't, the one subsidy provider in the community doesn't provide, then that it no longer is affordable to them. There's also a quality aspect to equity, and even though we applaud this sort of adoption of uniform quality standards, we don't want to lose track of the cultural nuances that may come into quality care for different families of different backgrounds, different histories, language, religion, culture, ability/disability. Quality for different families may look different, and we found that families really do need different things from their care providers, and providers don't always have the skills to provide to offer that. We notice, or there's research out there, for example, the majority of licensed preschool teachers are white, while a disproportionate number of assistant teachers are people of color, and that has an impact on the experience of the children in that setting, and also some real world ramifications, like Black boys especially being expelled at much higher rates than white boys. So there are certain biases that come into play and play out when it comes to sort of providing a quality education to all. And so holding that and allowing the research around that to bubble up feels very important in this conversation. We already mentioned the sort of equity considerations around health and safety, and if your only option is to attend an unlicensed, unregulated provider, you're more likely to be at risk of experiencing harm or injury. Okay. The final set of questions of slides in this deck are with respect to the recommendations that we're making. And as I already mentioned, when we were making these recommendations, we really wanted them to be comprehensive, to look at the stakeholders and to ground our findings in the evidence. We also wanted to craft the positions to be understood, to be open to bipartisanship, and stand the test of time. And our hope is that with the questions and the study that we developed, it will make it clear where we stand as an issue group and have clear consensus questions for all of you to consider, so that the process of updating our position is straightforward. So the questions that we are posing to all of you reflect the needs of the stakeholders that we identified in the beginning. We offer ideas for policy solutions, but it was with a couple of exceptions. We didn't want the position to lock ourselves into particular policy solutions. Again, in order to stand the test of time, so that we're not, setting ourselves up to like, check, yes, we got this one policy, therefore we achieved the entire objective, or consider it a failure if we didn't get that particular policy solution, but maybe we were able to advocate and work with legislators to get something else. So that's why you'll see some policy ideas in gray as options, but not something that we would see reflected in a final position update. Just kind of food for thought for consideration. So, for example, for parents, we would want to cap the amount that any family has to pay for child care, whether that is by doing what the Build Back Better Act is, which is set at 7% of your income limit, updates to the code. We want to incentivize supply by encouraging greater collaboration between the Department of Education and the Department of Labor to build a workforce system and a pipeline and a career pathway for people to enter the early childhood care and education field and earn a livable wage while they do that. We know other states like Massachusetts are really leaning into this approach, making the industry more attractive. We want to diversify supply to care for some of those differing needs among families. For young children or for providers, we want to ensure that they have a reliable source of income, recognizing that subsidies, they may come and go, but there's just a fundamental market failure or market incompatibility with expecting most providers in most geographies to cover their expenses, pay their staff a living wage, if their only source of income is parent fees. And so over the past few years, the country has, unintended benefit of the pandemic, piloted at a national scale these stabilization grants that essentially offered every provider in the country a blanket check to prop up, the industry and make some of the necessary investments, but that whole source of funding is expected to sunset in 2024. And so many providers have taken the opportunity to raise staff salaries, but knowing that it's only a temporary funding source, many have not. And so our hope is that something like that could be made permanent. Again, coming with the workforce development. I mentioned that we had a couple of exceptions to the no policy, and this is where they are. So for young children, the League of Women Voters is actually already committed to a universal pre-K program because the League of Women Voters National US ascribes or includes pre-K in their statement on every child should have access to a quality education. And so technically we already ascribe to that. I think that the distinction that we want to make is that we don't rely on federal funds to make that happen. We're not just saying, yes, that's a federal thing, we support it, but we're waiting for the federal government to take action. It's no, Virginia should commit to that, irrespective of whether the federal government does or doesn't. And many other states have already done that, including our neighbors in West Virginia. Maryland's taking steps towards that. DC has one of the oldest running universal preschool programs in the country. And so Virginia, we would argue, should follow suit. I mentioned we already want to require providers to be licensed and to honor children's diversity. For school-age children, we commit more broadly to making programs more accessible. As I mentioned, there hasn't been nearly enough sort of intention put behind out of school time. So that's after school and summer programming, and lots of different ideas out there that need further exploration related to child tax credit, having any sort of universal after school program, which Fairfax County actually is close to with our SAC program, the school age childcare programs that operates in nearly all of our elementary schools. Vermont is piloting it at a state level, but that could be something to further consider. And then wanting to ensure similar equality and equity in after school programs. So I realize we're just about at 8 o'clock. That presentation did end up getting quite comprehensive. If folks have a few minutes, just stick around. Would love to, maybe we can stop the recording, Carolyn, but happy to take questions.